Hello, my name is Garrett Schaub, and along with my co-authors Andrew Odland and Wade Johnson, and under the guidance of Dr. Laura Cotton, I am pleased to present our quality improvement project, colorectal cancer screening using routine Cologuard ordering at OSU Omeko Family Medicine. So, some background information: colorectal cancer remains the second leading cause of cancer-related death in the United States. The good news is that it's highly preventable. Screening allows us to detect and remove precancerous polyps before they become cancer. Current guidelines recommend screening beginning at age 45 or earlier with a family history and continuing through age 75. Despite national goals, 80% of screening coverage, only about 62% of eligible adults are currently screened. Our residency clinic started below that benchmark, which is why we launched this project. Our specific aim was straightforward: to increase the percentage of family medicine residency clinic patients who are appropriately screened for colorectal cancer by 5% between January 2025 and January 2026. This was a quality improvement project conducted across two outpatient primary care clinics from January 1st, 2025 through mid-February 2026. We compared this data to the full 2024 calendar year. Eligible patients were adults due for screening per USPSTF guidelines. We excluded those already up to date and those who aged out and those with known malignancy. The primary intervention was simple but powerful: routine ordering of Cologuard for every eligible patient identified as due for screening. We used EHR tools such as health maintenance alerts, smart phrases, standing workflows, and tracking reports to make this systematic rather than dependent on individual provider initiative. The results exceeded our goal. Overall, colorectal cancer screening completion rose from 48.2% in 2024 to 58.1% in 2025, which is an absolute increase of 8.9% and a relative improvement of nearly 18.5%. As you can see in the year-to-year comparison, both clinics demonstrated meaningful gains. The improvement is consistent across clinical sites, suggesting this approach is reproducible in other primary care settings as well. By shifting from opportunistic to proactive, systematic ordering of Cologuard, we significantly moved the needle on this critical preventative measure. In conclusion, routine ordering of Cologuard integrated into clinic workflow proved to be an effective strategy for increasing colorectal cancer screening rates. The project demonstrated that systematic team-based approaches can overcome reliance on individual provider recall and deliver measurable improvements in patient care. Going forward, we plan to fully integrate the workflow into routine operations, strengthen EMR supports and tracking of pending orders, develop robust follow-up processes for incomplete tests and positive results, create patient education materials, and share our tools and results so other departments and organizations can adopt similar processes. Thank you for your attention. We are happy to answer questions or share our workflow tools with anyone interested in improving colorectal cancer screening in their own practice.